Thanks, Ciara. At the outset, Ceann Comhairle, I'd like to convey my best wishes to Dr. Tony Holohan with his own health, and indeed all of those suffering from the coronavirus, and pay condolences to those who have passed away during or because of the COVID virus. I'd like to pay tribute to the frontline staff in hospitals and throughout our medical services, but to those frontline staff not so recognisable in our pharmacies, our supermarkets, at the checkouts, in supply chain factories, the drivers with deliveries, farmers and fishermen, for continuing to supply the food we eat. There is much talk of government and the great job they're doing. I'd like to commend the people of Ireland, who are so focused on flattening the curve, abiding by the measures Dr. Holohan has recommended be put in place. You are the people responsible for keeping the numbers at bay, and I thank you. Ceann Comhairle, COVID-19 has the potential to take over our entire ICU capacity and maybe even the entirety of our hospitals. And while I do commend the policies and recommendations being implemented, it cannot be at the expense of our essential services. There are many suffering with other serious illnesses such as cancer and mental health and many more. We cannot allow a situation to develop where the second-line effects are more detrimental because of the frontline actions. In Wexford, an election promised to open Arden House, the proposed new mental health facility, didn't happen. The current facility, Summerhill, its rooms are so small they've had to close because they're unable to meet the recommendation of social distancing during the COVID-19 crisis, and are only dealing with current patients over the phone on a 9-to-5 time frame. Last Friday, a mother called me in a very distressed state to say her 16-year-old son had told her he wanted to kill himself. As it was out of hours, she called CareDoc, who advised her to go to A&E, but ring ahead due to the virus. A&E advised that they had no one in which to deal with her son, and advised that she go straight to the Department of Psychiatry in Waterford, but advised that she ring ahead because of the virus. The Department of Psychiatry in Waterford, whose response was under no circumstances was she to present with the child, that they were virtually in lockdown and that Wexford General had a duty of care. She spent all night watching her son to ensure he stay alive, which was her only option, as there were no mental health services available to him. This situation is not because of COVID. The mental health services in Wexford have been neglected for years. Last Sunday saw a beautiful 17-year-old girl laid to rest, whom died by suicide. Her friend, who was laid to rest only a week before, also 17, and died by suicide. Their very vulnerable friends were unable to attend the funeral to say goodbye because of COVID. I know, Ceann Comhairle, we are in unprecedented times, but for parents and families, it's unprecedented when a child takes their own life. Mental health was a big issue before the election. It's now an even bigger issue. More people's mental health is being compromised due to poor domestic situations, exasperated by staying at home as required, leading to increased domestic violence incidents. And those who are worried with other life pressures, such as no jobs with bills to pay, and those already within the mental health system. I understand that politicians who say it's important that we take care of our mental health. It's important to go for a walk. Walks don't deal with mental health issues or self-harming or suicidal tendencies. Psychiatrists do. That's why we're all listening to the Chief Medical Officer, Dr. Tony Holohan, on how to handle COVID-19 and the measures to be implemented to stop the spread. What I'm asking today, in the case of mental health, I'm asking the government to listen to Dr. Kieran Moore, a consultant paediatric psychiatrist, who says that we now have to deal with the fact that patients, children who are normally attending CAMHS or other child psychiatry services, who cannot go to A&E, it is now a matter of urgency that the HSE set up an emergency service of which all outpatient child psychiatry and CAMHS staff must work differently and be available on rota 24/7 by telephone to deal with patients directly as required. Mental health is like all other medical services. It cannot be shut down. We do not need an increase in deaths in other illness areas because of COVID-19. And may I finish, Ceann Comhairle, saying that the reason I am here today is because I can't get answers to these questions. As I just delivered, the lack of accountability leads to a denial of citizens' rights. But I would like to point out that we are following all of the recommendations and not putting either our health or anyone else's health at risk. Thank you.